Thank you for kind introduction. It's my great honor to present our study result here in CH 2024. We conducted a multicenter study comparing the short-term outcomes of single-port robotic surgery and with single-port laparoscopic surgery. This research received a research fund from Intuitive Surgical. Single-port laparoscopic surgery for colorectal disease was first reported in 2008. Since that time, multiple studies has proven single-port laparoscopic surgery is safe and feasible for colorectal disease. However, single-port laparoscopic surgery has been considered to be a challenging technique for its restriction in the triangulation and retraction, even for experienced laparoscopic colorectal surgeons. In 2018, Intuitive Surgical launched the Da Vinci SP surgical system, which seemed to be helpful to overcome these limitations by having double joint and articulating endoscope. Till now, encouraging reports had been presented for its safety and efficacy. However, most studies are case series, and recently a few comparative studies were presented comparing single-port robotic surgery with multi-port laparoscopic surgery, multi-port robotic surgery, or single-port laparoscopic surgery. Although they showed promising outcomes, there has been only a few comparative studies in the same single-port platform, which can make an intuitive comparison between laparoscope and robot. In this context, we aim to validate the effectiveness of the single-port robot by gathering a larger dataset and plan the multicenter study. The purpose of this study is to validate the safety and performance of single-port robotic surgery with using the Da Vinci SP surgical system compared to single-port laparoscopic surgery for colon cancer. Patient underwent single-port robotic surgery for colon cancer from March 2019 to April 2023 in 4 institutions were candidates for this study. Eligible patients were to be diagnosed with histologically confirmed adenocarcinoma of the ascending and segmented colon and the clinical stage 1, 2, and 3. And rectal cancer, transverse colon cancer, and descending colon cancer patients were excluded for their challenges performing single-port laparoscopic surgery. As a comparing cohort, patients underwent single-port laparoscopic surgery in simple multicenter RCT, which compared single-port and multi-port laparoscopic surgery were analyzed. Simple trial was designed for delicate evaluation between single-port and multi-port laparoscopic surgery and has a high-quality dataset in which 7 university hospitals in South Korea participated, and 388 patients were enrolled. It has been the biggest cohort evaluating the single-port surgery in colorectal cancer ever reported. To adjust the heterogeneity of baseline characteristics and possible bias, we performed case matching analysis for variables of sex, age, BMI, ASA class, abdominal surgery history, and tumor locations. Contrary to the single-port laparoscopy cohort, which had performed the standardization of the procedures for single-port robotic surgery were heterogeneous among 4 institutions. Although the details of different procedures could not be fully described here, the platform of 4 institutions were like this. For right colectomy, main port site was umbilicus or suprapubic area. And for performing anterior section, main port site was umbilicus or right lower quadrant. There was another difference in whether making separated assistant port or not. By the lack of robotic advanced energy device and stapler, laparoscopic energy device and stapler was required through the separated port. Let me see the result of this study. There was heterogeneity between 2 groups in the baseline characteristics before case matching in terms of sex, age, ASA, and tumor location. After matching, 86 and 95 patients were selected from both groups, and patients were distributed fairly across all baseline characteristics. In the intraoperative details, the operation time was similar between two groups, but blood loss was less in robotic surgery group. Procedure conversion was fewer in robotic surgery group. The specimen extraction site was heterogeneous in robotic surgery group, but total incision length and length of specimen extraction site was similar. Drainage insertion was more popular in single-port robotic surgery group. The intraoperative complication was only exist in single-port laparoscopic surgery group, including bleeding, other organ injury, and anastomotic failure. Seeing the post-operative outcomes, there was significant difference in time to resuming diet and the length of hospital stay. Robotic surgery group showed shorter outcomes. Post-operative complication and readmission rate was similar. In details of post-operative complication rate, or like this, although the overall incidence was similar, grade 3 complications exist only in laparoscopic group. In the pathologic outcomes, tumor size and pathologic TN stage was comparable, but tumor differentiation was more heterogeneous between two groups. Similarly, pathologic TNM stage showed heterogeneity between two groups, and harvested lymph nodes was less in single-port robotic surgery group. Length to the both margins was comparable. Analyzing post-operative pain score, direct comparison could not be done. The laparoscopic surgery cohort evaluated the VAS score separately under the pre-planned protocol when the patient was at rest and when they are coughing. However, due to the retrospective nature of the robotic surgery cohort, this specific point could not be assessed. Comparing the VAS score between patient at rest after laparoscopic surgery and robotic surgery, overall pain score was not significantly different for 5 days after surgery. Pain score when coughing after laparoscopic surgery showed significantly higher than robotic surgery group. To summarize, single-port robotic surgery with Da Vinci SP system showed better perioperative outcomes than single-port laparoscopic surgery in terms of blood loss, conversion, intraoperative complication, and patient recovery, including diet resuming and hospital stay. However, single-port robotic surgery showed less harvested lymph nodes, which might be the reflection of heterogeneity in tumor stage and tumor differentiation. Further well-designed prospective study is required. Thank you.